Are you gearing up for the NCLEX RN and feeling overwhelmed? Today, I'm sharing my own review of the essential lectures you need to pass. These insights cut through the noise and give you exactly what you need to succeed. But those lectures are long. Today, we're doing something epic. In just 8 minutes, I'm going to walk you through the absolute high-yield essentials from my own review. We'll hit the core concepts, my favorite prioritization strategies, and those light bulb moments that make the NCLEX click. This isn't a substitute for full lectures, but it is your ultimate strategic roadmap. Grab a notebook and let's dive into my NCLEX first lecture, prioritization. If you take away one thing, it's that the NCLEX is a safety exam. Your job is to identify the sickest, most unstable patient and act on them first. Think ABC plus D plus E, airway, breathing, circulation, disability, and exposure. Always prioritize these. An unstable patient with an altered mental status trumps a stable patient with chronic pain. There's delegation. As an RN, you cannot delegate tasks that require assessment, evaluation, or teaching. LPNs can reinforce teaching. UAPs assist with ADLs and vital signs on stable patients. Know your scopes. And the nursing process, ADPIE, assessment, diagnosis, planning, implementation, evaluation. If you haven't assessed, you can't intervene. Psych. Big takeaway. Psych patients are medically healthy patients who are acting crazy. Unless there's a medical reason, like an electrolyte imbalance or infection, assume the bizarre behavior is psychiatric. Know your defense mechanisms. Rationalization, denial, understand what they look like. For schizophrenia, focus on safety and building trust. Don't argue with delusions, reorient to reality gently or focus on their feelings. For bipolar disorder, think mania is a danger zone. Protect the client from themselves, set limits. And for depression, remember suicide risk, especially when they suddenly have more energy. For Pharm, my approach is to simplify it with patterns and suffixes. Learn the drug classes.
Can't remember if it's SSRIs or antipsychotics that cause weight gain. Here is how to never mix them up again. Use the acronym SLAM for 4 major psych drug classes. S for SSRIs or selective serotonin reuptake inhibitors like fluoxetine and sertraline. Think sexual side effects, their signature problem. L for lithium and mood stabilizers such as lithium carbonate and valproate. Remember, lithium makes you leak, kidney and thyroid issues. A for antipsychotics like risperidone and olanzapine. They make you accumulate diabetes and movement disorders. Think bigger and shakier. M for anxiolytics, especially benzodiazepines like diazepam and lorazepam, memory problems and motor issues. They make you forget and fall. Here is the ultimate memory trick. Picture a slam dunk. The player shoots sexual, SSRIs, leaks, lithium, accumulates height, antipsychotics, then memory and motor, anxiolytics, sexual leak, accumulate memory and motor. Use this and you will not confuse psych drug side effects again. Aminoglycosides are powerful antibiotics. Let's explore their key points. Common side effects include 1. Ototoxicity, hearing loss. 2. Nephrotoxicity, kidney damage. 3. Neurotoxicity, muscle weakness, numbness. Examples of aminoglycosides: 1. Gentamicin. 2. Tobramycin. 3. Amikacin. 4. Kanamycin. Here's a mnemonic to remember. Aminoglycosides, gentle Toby 8 kids. Gentamicin, tobramycin, amikacin, kanamycin. Aminoglycosides are effective antibiotics. Understanding their side effects and proper use is crucial.
And when in doubt, the NCLEX loves to test on cardiac drugs and insulin. One major rule, SATA questions. Treat each option as a true or false statement. Another crucial concept, always pick the answer that keeps the client safe and in the hospital. The hospital is generally the safest place for unstable patients. Also, never pick an answer that assesses a psychosocial problem when the question is physiological. Address the immediate physical need first, and remember, trends over single values. A worsening trend over hours is the true red flag. Time for electrolytes. I focus on potassium K+, and calcium Ca2+. Remember this, potassium does the same as the prefix except for HR and UO. So hyperkalemia means everything goes up, muscle, excitability, irritability, except HR and urine output go down. For calcium, remember, calcium does the opposite of the prefix. So hypercalcemia means everything goes down. Constipation, muscle weakness. Hypercalcemia means everything goes up. Spasms, Cross-Tex, Trousseau's signs. The dangers: high potassium can stop the heart, low calcium can lead to laryngospasm and seizures. The infamous acid-base balance, forget full compensation, focus on Rome, R respiratory opposite, M metabolic equal. If pH and PaCO2 are moving in opposite directions, it's a respiratory problem. If pH and HCO3 are moving in the same direction, it's a metabolic problem. Practice this pattern. It's a guaranteed NCLEX question. Moving to endocrine, focusing on diabetes, know the distinctions and complications. Type 1 is ketosis prone. The acute complication is DKA, diabetic ketoacidosis. Think dehydration, cuss-mole respirations, fruity breath. Always give fluids first. Then insulin. Type 2's big complication is HHNS, hyperosmolar, hyperglycemic, non-ketotic syndrome. Extreme dehydration, no ketones. Again, fluids are critical. Know your insulins, onset, peak, and duration. Which do you draw up first if mixing, regular before NPH? Next, GI. I simplify two common GI disorders with opposite care. Hiatal hernia is when contents move the wrong way. Think hiatal hernia. Keep hob high after meals. Limit fluids with meals. Dumping syndrome is when contents dump too quickly. You want things to go slow. Keep the hob low, flat. Restrict fluids with meals and lie down after eating. Opposite interventions. Perfect for NCLEX. All right, musculoskeletal. I emphasize care for traction and casts. For traction, remember the 3 rules. Ropes hang free, weights hang free, client is aligned in the bed. Never release weights without an order. For casts, the biggest concern is compartment syndrome. This is a medical emergency. Look for the 6 Ps: pain, paresthesia, pallor, paralysis, pulselessness, poikilothermia. The earliest sign is often pain disproportionate to the injury. Notify the HCP immediately. Heading into maternity, always prioritize fetal well-being. Remember, VEAL CHOP for interpreting FHR, fetal heart rate patterns, variable decil, cord compression, late decil, placental insufficiency, bad. For late decelerations, intervention is needed. Turn the mother, give IV fluids, oxygen. For the newborn, remember the immediate priorities: airway, warmth, ABGs scores. Now, pediatrics. My big message: PEDS is just smaller adults until they're not. For congenital heart defects, remember true BL defects: right to left shunt, cyanotic, blue baby, need a T, surgery. Examples: tetralogy of Fallot. Non-trouble are left to right, acyanotic. The NCLEX often tests on developmental milestones. Know the rough ages for sitting, crawling, walking. In PEDS, always prioritize safety and involve infection control. Contact droplet airborne precautions. He reviews essential lab values you need to know: HGB, HCT, KNR, etc. Understand what abnormal values mean. His final advice: what is the worst thing that can happen and how do I prevent it? Always think safety, always think unstable versus stable. Trust. Wow, we just blitzed through the high-yield essentials in 30 minutes. Hopefully, you're feeling more confident and have a clearer roadmap. Remember, this is your strategic overview. Go back and review your notes and practice NCLEX style questions applying these principles. If this video helped, please give it a thumbs up, subscribe for more NCLEX tips, and let me know in the comments which climate lecture was your favorite. You've got this, future nerd.